signal has come. आप सभी का स्वागत है। स्वागत है हमारे विशिष्ट मेहमानों का and the stalwarts of medical fraternity जिनको इस पल का हिस्सेदार बनने का अवसर मिला है। Today is a great day. Today is Holi, जो कि रंगों का और दिल को जोड़ने का त्योहार है, and today is a Women's Day. It will become all the more memorable day because of the landmark launch, All India launch of the film called State of Art Examination of Survivor of Sexual Assault and Rape. Please remember, this landmark day will be 8th March 1923. Today the Prime Minister was saying, भारत का निर्माण नारी के योगदान के बिना अधूरा है, अकल्पनीय है। राष्ट्र के संपूर्ण विकास के लिए नारी का सशक्तिकरण बहुत ही इंपॉर्टेंट है। केंद्र सरकार पिछले कुछ वर्षों में महिलाओं के स्वावलंबन के दिशा में विशेष कार्य कर रही है। फिर भी कहीं हमारे आत्मसम्मान को हमारी सोसाइटी ने नुकसान पहुंचाया है। ह्यूमन ट्रैफिकिंग, महिलाओं और लड़कियों से छेड़छाड़ी, अभद्र वार्तालाप, सेक्सुअल असॉल्ट एंड रेप के केसेस बढ़े ही हैं, कम होने का नाम ही नहीं ले रहे। क्यों? ये क्यों हो रहा है? इसका एक मुख्य कारण है कि सर्वाइवर ऑफ सेक्सुअल असॉल्ट के जो केसेस हैं, उनका अपराध कोर्ट में, उनके अगेंस्ट अपराध कोर्ट में साबित नहीं हो पाता है। That's why conviction rate is very low. इसके लिए कुछ हद तक we doctors are also responsible. क्योंकि जब तक एक अच्छा मेडिकल एग्जामिनेशन नहीं होगा, फ्लॉलेस एग्जामिनेशन नहीं होगा, तो एक ग्रेट फोरेंसिक लैब रिपोर्ट नहीं मिलेगी एंड उसके कारण कन्विक्शन रेट नहीं बढ़ पाएगा। ये तभी होगा जब हम लोगों को पूरी गाइडलाइंस के बारे में पूरा पता हो एंड 100% डेडिकेशन और पैशन के साथ हम एग्जामिनेशन करें, तभी फोरेंसिक लैब की रिपोर्ट के माध्यम से फास्ट ट्रैक द्वारा कन्विक्शन रेट को बढ़ाया जा सकता है। इंडियन मेडिकल एसोसिएशन, नॉर्थ इंडिया गायनेकोलॉजिस्ट फोरम एंड दिल्ली गायनेकोलॉजिस्ट फोरम के मेंबर्स की यही अपील है। ये मुद्दा 2003 में पहली बार उठा था, when it was brought out by me that there are no guidelines are available in the country. There's a no uniformity of medical examination of survivors of sexual assault and rape victims. कहते हैं जो आप सोचोगे वही हो जाएगा। In 2004 and 2006, as the chairman of Women Wing of Indian Medical Association, मुझे सौभाग्य प्राप्त हुआ to get the help from the Ministry of Women and Child Development, from the UNICEF, and all right support of Indian Medical Association. एक मैनुअल मिला जिसका नाम है ग्रीन मैनुअल of the survivors of examination of rape victim. उसके बाद ये फिल्म बनी, and this particular film, which was released in 2006, has become a benchmark in empowering doctors to learn medical examination. And this is used across the country, and not only in India, but in neighboring countries as well. But then a lot of water has flown below the bridge. 2006 के बाद निर्भया कांड हुआ, सभी आप लोग सभी जानते हैं। जस्टिस वर्मा की रिपोर्ट आई और गवर्नमेंट ऑफ इंडिया ने 2014 में गाइडलाइंस बनाई। उसके बाद बहुत सारे जजमेंट्स आए एंड लास्ट हैज बीन द सुप्रीम कोर्ट लैंडमार्क जजमेंट ऑन 31 अक्टूबर 2022। नाउ इसने सरकार की भी आंखें खोली एंड मेडिकल फ्रेटर्निटी की भी आंखें खोली। कि अभी काम अधूरा है, इसको कमर कस के पूरा करना है। गवर्नमेंट तो करेगी ही, पर डॉक्टर्स को अपना प्रयास जारी रखना है। So today, All India release of this particular film on the International Women's Day is the biggest tribute of North India Gynecologist Forum, Delhi Gynecologist Forum, and our big brother Indian Medical Association to women fraternity. महिलाओं के सम्मान से जीने के लिए उनको फास्ट ट्रैक से जस्टिस मिलना बहुत जरूरी है, एंड ये फिल्म एक मील का पत्थर साबित होगी। Before I request my colleague Dr. Sangeeta Gupta to take over, there will be Saraswati Vandana, and then after Saraswati Vandana, there will be a little talk on highlighting the various aspects of this particular film by my colleague Dr. Sangeeta Gupta. She had been a former ex-head of the Department of ESI Vasai Darapur. She's a vice president and president of Delhi Gynecologist Forum and vice chairman of North India Gynecologist Forum.
Shubham kurutvam kalyanam arogyam dhanasampadah. Shubham kurutvam kalyanam arogyam dhanasampadah. Shatrubuddhi vinashaya Deepajyotirnamostute. Deepajyotirnamostute. Shubham kurutvam kalyanam आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः.
Good evening, everybody. I welcome you all on the celebration of International Women's Day. Every woman has a right to dignity, optimal growth, and a violence-free life. These are basic human rights guaranteed by our Constitution over more than 7 decades ago, but still, discrimination against women is rampant, may it be in the form of gender-biased sex selection, infanticide, lack of access to health, education, nutrition, or violence. The increasing incidence of violence against women greatly impact the physical, mental, sexual and reproductive health of women. It also impacts their self-esteem, ability to work, and to make decisions about their life. Health institutions are important and are first entry point for women facing violence because these healthcare providers are strategically placed and very helpful in identifying the women who have suffered the violence. The statistics of women violence are alarming in India. 1 in every 3 women suffers the violence. Before last 10 years, we were more concerned about child trafficking. But after the case of Nirbhaya, we are very much aware about women's sexual violence, and there is increasing number of reporting of sexual violence in India. After this, Government of India has amended the criminal laws, investigation procedures, and has even amended how juvenile, that is legal term for minors, are prosecuted. After the Nirbhaya case, Justice Verma Committee was made, and as per the Justice Verma Committee report, which came out in January 2013, there is a need to standardize medical evidence collection during the treatment of a sexually assaulted victim. The Criminal Law Amendment Act 2013 lays emphasis on examination, treatment, both physical and psychological, in addition to evidence collection that was the case earlier. Introduction of Protection of Children from Sexual Offences Act 2012, that is POCSO Act, has also changed the dimensions of care in case of child that is below 18 years. Rape law has been made more stringent with zero tolerance for offenders. The Criminal Law Amendment Act 2013 in section 357C CRPC also says that both private and public health professionals are obligated to provide treatment to rape survivors, and also that denial of treatment is punishable. Honorable Supreme Court on 31st October 2022 delivered a landmark judgment in connection with Criminal Appeal number 1441 of 2022 and directed union government as well as the state governments for 3 points. First, ensure that the guidelines formulated by the Ministry of Health and Family Welfare are circulated to all government and private hospitals. Second, conduct workshops for health providers to communicate that the appropriate procedure to be adopted while examining survivors of sexual assault and rape. And thirdly, review the curriculum in medical schools with a view to ensuring that the two-finger test or per vaginum examination is not prescribed as one of the procedures to be. Many a times, it has been experienced in the past in such cases that medical evidence has not been recorded and documented in proper fashion, leading thereby to a poor conviction rate in rape cases. So it becomes our duty, apart from attending and treating the sexually assaulted survivors, we have the responsibility to record and document the medical aspects in order that such cases, when they come up before the criminal justice system, are not found wanting in the quality of evidence produced by the prosecution during trial. Keeping all these considerations into the view, under the able guidance of Madam Sharda Jain, NIGF and DGF took the initiative to revise the film on sexually assaulted victims examination. In fact, when Madam was chairperson of IMA Women Wing in 2006, with the help of IMA, Ministry of Child and Women Development and UNICEF, we made a film for examination of sexually assaulted victim in purview of child trafficking. But after the case of Nirbhaya in 2012, we all are now looking forward, and the ministry has come out with the latest guidelines in 2014 regarding the medico-legal care for survivors and victims of sexual violence. So now, again under the guidance of Madam Sharda Jain, we have revised this film with additions of points based on this 2014 regulations. And on this day, through this film, I would like to avail the opportunity of appealing to every private government hospital in the country to give care to survivor as a part of their corporate social responsibility. In doing so, they would be contributing to make India a better and safe place to live in for women. I am sure this film will work as a step-by-step guide to provide comprehensive care to survivors of sexual assault in an informed manner. Thanks. Now, I will invite Dr. Sharad to give comments.
Vandana.
Dr. Vandana to give
Yes.
comments about the initiative which we have taken and guide us and help us in propagating the examination film to the periphery of the Delhi and other areas. Dr. Vandana Bakka is Directorate of Family Welfare, GNCT of Delhi. She is Vice Chairperson of State Health Society and State Program Officer for Quality Assurance and Patient Safety, Delhi State Health Mission. Welcome, Dr. Vandana.
Thank you so much, Dr. Sangeeta, and my greetings again to Dr. Sharda, the whole team, the esteemed guest, the chairperson of the conference today, and all the stalwarts, and my teachers, and all the participants who are present today, because all of them have actually taken up their responsibility to attend this very, very important session, which is not just not just for the knowledge gaining or knowledge sharing, but this is also one of our responsibilities, one of our moral obligation to know about it, to spread the information, and to make sure that there should not be any lacuna from our side in achieving something which is called safety for women, something which results in achieving the natural birth ratio, not only in Delhi but throughout India, which is very skewed in some of the states. Uh, अब कुछ तो ऐसे हुए instances जैसे it was a very unfortunate that we had to have a Nirbhaya case to wake up to these things. Like Ma'am Sharda has already mentioned that they initiated this thing long time back. That time it was initiated for in context of child trafficking. But again, it took so long for such, and lots of other unfortunate instances happened. I still remember one instance of ESI hospital, Basai Darapur Hostel, when one of the doctors met with these unfortunate circumstances. And the doctors were implicated because neither were they trained nor they were informed about the how which all samples they need to collect and the method of collecting the samples. Whatever samples they had even submitted were not the quality was not just inadequate, but they all were implicated because of the negligence. But I think it was negligence not on their part, but it was negligence on part of the system, on part of the state, who failed to provide them the adequate knowledge and uh, the importance of exercising their knowledge or using it, and their demanding for the proper infrastructure for conducting the examination. They were not even aware that it was obligatory on their part to inform the police or the authorities. So it was a very, very important step that we needed to increase the needed some major steps for capacity building. It was our responsibility to get ourselves updated, but also the responsibility of the system and state to ensure that they get proper information. They get information from the authentic sources. So some efforts were done, but it was not a concrete effort. So the information was coming from every hospital. They wanted them to be trained in examination of sexual assault victims, but there was lots of hesitancy. So some people would say, गायनी वालों का काम नहीं है ना, emergency doctors को बताओ. And emergency people would say, अरे इतनी भीड़ होती है गायनी examination में, इतना time लगता है. You keep it to gynae people, which showed lack of sensitivity on our part. It was very important that all of us should actually feel the. I can see that passion in Dr. Sharda Jan ma'am. So that passion was required to be inculcated everywhere. So it has been cascading, ma'am, after your so much of initiatives, and this is very important that we trained lots of people. Almost all the medical officers in the government hospitals in Delhi were trained about the examination of sexual assault victims, but the training never cascaded down, and there was lots of attrition among the resident doctors. Since this was not a very major part of a resident doctor's curriculum, it was not a major part of UG curriculum, so they were not even given the due, they could not really grasp the due significance of examination. So after POXO Act came, everybody became aware that okay, you are supposed to take care of the children. So my best wishes
Dr.
and
Vandana, I am
congratulations.
absolutely thankful to you for from the medical fraternity, because being an administrator, you are the person who are a mover for anemia-free India movement in Delhi, and I'm sure you will be also the motivator as for the examination part is concerned.
Definitely,
Now,
ma'am. I
yes.
have been your student and I will always remain your student. So I really feel that you are the biggest motivator that we have. And my even my elder sister was your student, so she also feels very uh, grateful to you for all that you have, all the values that you have given us while we were students. So thank you so much, ma'am, for that.
Now the time has come, and it's my heartiest thanks that I invite Professor Sarath Kumar Agarwal, who is the National IMA President, and he's a consultant healthcare projects, operations strategies, and medical legal expert. It was a real surprise to me, Hugh, sir, that you are a forensic expert as well as medical legal expert. And anybody who reaches this top position of National President of Indian Medical Association is decorated with many, many awards and accolades. I'm happy that you are a forensic and a medical legal expert, and let's hear your views at the launch of this particular thing. I think, sir, Indian Medical Association has contributed in a very big way, and I will see that my request is that through Indian Medical Association, each and every doctor, private sector or the government sector, is our responsibility to see to it that they are empowered to examination. So over to you, sir.
Thank you, madam. Respected Dr. Sharda Jain, Dr. Sangeeta Gupta, Dr. Anita Rajoria, Dr. Gaurav Agrawal, and beloved late Dr. Sunita Fotedar, the entire team of NIGF, TGF. First of all, happy Holi to all of you, and my best wishes on International Women's Day to all the wonderful, beautiful ladies participating in this launch of this film. As we all know that there are millions of young children, especially girls children, not only in the whole world, but also in India, who are forced into trafficking for the purpose of commercial sexual exploitation and sexual abuse, as well as lot of sexual assault and rape survivors. When such cases of sexual abuse, trafficking, or the assaults are brought to the court of law for administration of justice, the one key determinant that helps in providing justice to the victim and punishment to the offenders of such crime is the proper and thorough medical examination of the victim. In an endeavor to have a uniform protocol of medical examination of victim of these sexual abuse or the assault throughout the country, the UNICEF, Ministry of Women and Child, IMA through its gynecologists, senior gynecologists, NIGF and DGF, they have prepared a dedicated film for training of medical officer. The film details the entire process of history taking, consent process, medical examination, evidence collection, and treatment of the victim of sexual assault. I have been told that this film has been shown to around 50 medical colleges, and as a pilot project in a vulnerable state of the country like Northeast, UP, Bihar, Odisha, etc. I would be happy and would strongly urge to the ministry to take this film, which details the entire process of medical examination of the victim, to every medical college in the country and medical officer practicing in every district hospital, so that they are empowered in the examination process and are able to deliver justice to the unfortunate victim of these sexual assault and abuse. I hope my message is heard loud and clear by the powers that be, and also especially by ministry and the NMC in this regard. This film should become part and parcel of the MBBS curriculum, especially the forensic medicine, gynecology, pediatric curriculum, where such cases are brought for medical examination or for treatment. See, IMA, as ma'am asked me, IMA always play a big brother role and always taken up the issues related with the either with the society or for the medical fraternity. And we are always proactive. As madam said that it was started with the IMA. They told me that the shooting started from the IMA building only. And now we are launching on an International Women's Day. So I promise you the full cooperation from IMA as we discussed that day, we should organize a walkathon for the awareness of the pupil of the country, because definitely the examination protocol should be it's matter to the medical officers and the students in the medical college, but there should be awareness for the general public also. So that I urge you, under your initiation with the support of IMA, if we could organize a walkathon in Delhi, and that can be replicated on the same day in across the country through IMA. So I volunteer this thing to NIGF and DGF and all the leaders from IMA who is participating, because IMA has also circulated this meeting circular to amongst the member. So this is my suggestion and my full support from the IMA to all the good work done by you. Again, congratulations to Dr. Sharda Jain ma'am and her team, and Gaurav Agrawal for giving the forensic support, and the medical legal expert. Thank you, and all the best to all of you.
Thank you, Dr. Sharad, for such a cooperation on a holy day. Words of unity coming from you. I assured you from the North India Gynecologist Forum side, as well as from the Delhi Gynecologist Forum, that our all support will be there with Indian Medical Association for the good work for the public and the fraternity as well. So thank you very much for these golden words, Dr. Sharad. I think your cooperation in future will be absolutely welcoming. Now,
can I come in for a small moment? For
yes.
a very small moment.
Yes, yes.
So it was very enlightening to hear you, ma'am, and Dr. Sharad Agrawal. और मैं समझता हूँ women के लिए तो women बात करेंगी ही जब कोई प्रॉब्लम होगी. It is yes, men के लिए कोई प्रॉब्लम होगी तो men बात करेंगे ना. It is when for women's issues men come forward and talk. So I should these kind of should have more men, because then it gives a good impression that yes, there are so many people in the world who understand these issues and are coming forward to address this. So just a humble contribution, there should be more men in women's conferences and vice versa. Thank you, ma'am.
So
But
Dr.
here
Gaurav, there
I
are lot of men from IMA, they have joined it.
Yes.
On the website of the Crime Bureau of India is posted a crime clock. The clock never stops ticking, nor do the rapes.
This is a true illustration. A girl was brought from a village to a city for domestic work. She was sold to a brothel. She was recovered during a raid on the brothel. On medical examination, it was found that she had been physically tortured and her genitalia had been dilated with tampons to adjust to disproportionate male organ. She also showed old healed hymen and tears in the vaginal wall. She was tested positive for gonorrhea and semen traces were also recovered from stains. An age determination test corroborated she was just 12 years.
A young girl is imported for commercial sexual exploitation. It is the beginning of repeated sexual assaults on the adolescent. The number of sexual assaults on her rise with every passing hour. Social scientists make 4 points. The statistics reported by the Crime Bureau are just the tip of the iceberg. Owing to guilt, shame, cultural compulsions and poor knowledge of law, very few cases of sexual abuse are disclosed and reported in our country. It is a fact that both rape and sexual trafficking cases are on the rise. In our land, conviction rate of rapists and sexual criminals is very low. Varying from state to state, only 20 to 30% of the accused get convicted and punished. There is a relationship between conviction rate and sexual crimes. Higher conviction rate can help in the prevention of sexual crimes and trafficking. Doctors are the most crucial link in raising the conviction rate. In all the sexual abuse cases in the court of law, the evidence collected by the doctors through medical examination of the rape victim the age determination test, and the medico-legal report play a key role in deciding whether the offender will get convicted or not.
All of us are clear that to prevent rape and immoral sexual trafficking, the conviction rate must be raised in our country today. The right legislation is in place. What is needed is medical evidence that goes in favor of the victim in the court of law. As the nodal agency for controlling trafficking, Indian Medical Association is committed to raise the conviction rate and to get justice to the rape victims. Indian Medical Association's approach is bilateral. It is seeking the government support to establish rape crisis centers in the entire country. At the same time, it has taken up steps to equip the medical officers with the skills required for providing accurate medical evidence. This film is a part of that process. Through this film, my colleagues here, Dr. Sunita Fotedar, Senior Specialist Department of Gynae, Swami Dayanand Hospital, Shahadra, Dr. Sangeeta Gupta, Head of the Department of Gynae, ESI Hospital, Basai Darapur, and Dr. Gaurav Agarwal, the former Assistant Professor, Vardhaman Mahavir Medical College and Safdarjung Hospital, will take you through the entire process of medical examination through a standard protocol to be followed throughout the country. The original film was made on the request of Ministry of Women and Child Development in 2006 with the aim of imparting knowledge about standardized and uniform medico-legal examination of survivor of sexual assault. And now it is revised in 2023 by Delhi Gynecologist Forum and North India Gynecologist Forum based on Government of India guidelines of 2014 after Nirbhaya's case. We also incorporated POCSO Act of 2012 for medical fraternities' knowledge and compliance. The Honorable Supreme Court of India is serious and taken a landmark decision on 31st October 22. Supreme Court directed the Union Government as well as the state governments to ensure that the guidelines formulated by Ministry of Health and Family Welfare to be circulated to all government and private hospitals. Conduct workshops for health providers to communicate the appropriate procedure to be adopted while examining the survivors of sexual assault and rape. Review the curriculum in medical schools with a view to ensure that the two-finger test or per vaginal examination is not prescribed as one of the procedures to be adopted while examining survivors of sexual assault and rape. Guidelines and protocols on medico-legal care for survivors, victims of sexual violence. Based on the guidelines of Ministry of Health and Family Welfare 2014. The guidelines are essentially aimed at doctors who might one day be called upon handle the survivor of sexual assault in the course of their duty, whether in government hospital or private. Sexual assault victim cannot be denied treatment in either of these hospitals when they approach them, as denial has lately been made a cognizable criminal offence punishable with appropriate jail terms or fines or both. Apart from attending or treating, doctor's responsibility and duty is in recording and documenting the medical aspects in order that such cases, when they come before the criminal justice system, are not found wanting in the quality of evidence produced by the prosecution during trial, leading otherwise to poor conviction in rape cases. There are legal obligations of health professionals. As per section 164A of Criminal Procedure Code, examination of a case of a rape shall be conducted by registered medical practitioner without delay and a meticulous report to be prepared by the RMP. The health professional need to respond comprehensively to the need of survivors. Comprehensive response care means initial resuscitation and first aid, informed consent, detailed history taking, medical examination, age estimation if requested by the investigating agency, evidence collection as per the protocol of Government of India 2014. Documentation, packing, sealing and handling over the collection evidence to police, treatment of injuries, testing, prophylaxis for STIs, HIV, hepatitis B and pregnancy, psychological support and counseling, referral for further help to shelter home or for legal support. This particular chart gives you overview of this comprehensive response care. Operation guidelines. Every hospital, clinic must have a standard operating procedure for management of sexual violence to provide comprehensive services for the smooth handling of cases and clarity of roles of each staff, to have uniform practices across all doctors in the hospital. The POCSO Act has come into force with effect from November 2012, along with the rules framed. It is a comprehensive law to provide protection to the children from the offense of sexual assault, sexual harassment and pornography, to safeguard the interest of the child at every stage of judicial process, for the proper development of child in view of his or her protection of the right to privacy and confidentiality. The most important provision of the Act is that it gives a definition of the child. It defines different forms of sexual abuse, including penetrative and non-penetrative assault, and what constitutes aggravated sexual assault. The prescribed punishment, the mandatory reporting of the crime. It is also important that abatement of offence under the Act would also attract the punishment as that of the offence committed. Examination of the child shall be conducted even before a FIR or a complaint is registered by a government doctor in a government hospital or a hospital run by local authority, with the consent of the child or of a person competent to give consent on the behalf of the child. The examination must be done within 24 hours from the time of receiving information about the offence. Anesthesia can be administered only in those cases to enable medical examination which are done in the best interest of survivor and are not possible otherwise. The doctor shall forward the report to the investigating officer without any delay, who shall forward it to the magistrate. As far as consent is concerned, in the POCSO Act, a child is one who is aged below 18 years. Minimum age of survivor for giving valid consent for medical examination is 12 years as per provision of section 89 and 90 of IPC. In case of child below 12 years of age, whenever parents and or guardians are not available for giving consent for examination, then informed consent can be obtained from a panel of senior doctors in an administrative position in the hospital who will act in the best interest of the child. When doctor suspects that the child has been or is being sexually abused, even in the absence of consent of a child or a parent, have mandatory legal obligation to report child sexual assault cases to the appropriate authorities. If he fails to do so, he may be liable for punishment of imprisonment of up to 6 months with or without fine. Standard protocol for medical legal examination of survivor or sexual assault is prepared by National Institute of Criminology and Forensic Medicine, Ministry of Home Affairs, Government of India. The main aim of standard protocol is to collect evidentiary material without missing any step during medical legal examination of survivors of sexual assault. Now, points to remember. Incident of rape occurred or not is a legal issue and not a medical diagnosis. Hence, on the basis of medical examination, doctors should not conclude whether rape has occurred or not. Another point on spermatozoa. Spermatozoa may be recovered from cervix and posterior fornix for longer period of time than in vagina after the assault. Hence, it is advisable to collect swabs up to at least 3 weeks after the assault, as per merit of the case and whether possible considering the age of survivor. This table clearly presents that the motile sperms can be seen up to 7 to 8 days, while nile motile sperms can be seen in vagina up to 10 days and in the cervix up to 19 days. Informed consent. The consent of the survivor must be taken before examination. If the survivor is less than 12 years, obtain the consent of parent or guardian. A doctor must inform the survivor, parent or guardian regarding the nature and the purpose of examination, that the examination will help in prosecution of those who committed the crime, that the procedure may involve an examination of the mouth, breasts, vagina, anus and rectum, that the examination may include removing and isolating clothings and samples such as scalp hair, genital swabs, nails clipping, blood, etc. That the survivor or the parent or guardian, any other person in whom the child reposes trust, has a legal right to refuse full or part of the examination. That refusal of consent would not affect her treatment aspect of the survivor, but may hinder the conviction of accused. Informed refusal must be recorded with the signature of the survivor and witness. Information to police. As per law, the examining doctor is required to inform the police about the incident irrespective of the consent for examination. Point to remember as far as per vaginam and per speculum examination is concerned, should not be done unless required for detection of injuries or for medical treatment. No comment should be made on shape, size and elasticity of the anal and vaginal opening or about previous sexual experience or habituation to anal or vaginal intercourse. Two-finger test neither to be conducted nor commented upon. Injury documentation must be done in all cases. Toluidine blue dye, alternate light source, wood lamp, colposcope may be used wherever required to highlight injuries, bite marks invisible to the naked eye. Depict the injuries on appropriately body diagrams and record with details the size, site, shape, color, etc. Absence of injuries may be due to inability of the survivor to offer resistance to the assailant because of intoxication, threats and unconsciousness. Age estimation is an important part of the survivor examination if relevant or asked by the police or court. Medical legal examination report has to be made in triplicate. The original has to be given to the police, the second copy for survivor and the third for the hospital record. Forensic evidence collection. Strive to collect as much evidence as possible from survivor guided by scope of informed consent, history given regarding sexual assault and examination findings. Forensic evidence collection, packaging and forwarding of evidence material for forensic analysis. Based upon the history of the case, evidence material should be collected in pre-labeled envelope contained in the evidence collection kit. The swabs must be thoroughly dried before putting it into envelopes. The clothing, if wet or having body fluid stained, should be thoroughly air washed before packing. Reference blood sample of the survivor should preferably be collected on blood collection card for DNA testing as well. For this, wipe the tip of the ring or middle finger with betadine swab, prick it with sterile lancet and allow a few drops of the blood to fall within the circle of the card. Dry it before packing. This is the forensic evidence collection kit called SAFE kit. Collection of samples for hospital lab are blood for HIV, VDRL and hepatitis B, urine tests for pregnancy, ultrasound for pregnancy, internal injury, X-ray for injury. If no evidence material is collected in any envelope of the kit, the envelope should be crossed and no sample collected should be written on it. The evidence collection kit should be sealed with tamper-proof seal. Medical sample should be sent to hospital lab and forensic samples should be packed in evidence collection kit. Provisional opinion drafting should be done immediately after examination of survivor on the basis of case particulars and findings of detailed clinical examination. Final opinion to be formulated after receiving the reports of the forensic lab. It should be always kept in mind that our normal examination findings neither refute nor confirm the forceful sexual intercourse. Hence, circumstantial and other evidence may be taken into consideration. The types of evidence to be collected will depend on the actual time of medical examination. Post-sexual violence, keeping in mind that there could be delays in reaching the healthcare facility for medical examination due to various social issues and barriers. Hope this film inspires you to do perfect medico-legal examination.
Elimination of sexual abuse and trafficking of women and children for sexual exploitation is a key priority area for the Department of Women and Child Development. The department is studying the problem in greater depth and collating data. It is building awareness in civil society and NGOs. It is advocating national legislation at par with international and regional instruments for eliminating trafficking. The film will now instruct you on how to conduct a state-of-the-art examination of a young female sexual assault victim, medical forensic examination with in-depth explanation, age determination. Summary of forensic examination. The film has the following learning objectives: to introduce a standard kit with all the tools required for medical examination, to learn proper method of conducting the forensic history and physical examination, to learn proper evidence collection techniques, to learn the right procedures of age determination, to learn the prophylactic regimens to prevent disease and unwanted pregnancy, to know where to access technical information on forensic medical examination. This here is a standardized kit being demonstrated. In some cases, you may not need to use all the envelopes of the kit. For example, if no debris is found on the body surface, the packet of debris will not be used and no specimen will be written across the label. In other situations, you may need extra supplies in the form of needles and oral swabs from the hospital stores. For successful forensic examination, you must do the following. Pay a thorough and close attention to details. Wear gloves at all times. Touching the victim, the kit, or its contents with bare hands may leave your DNA in the evidence. Wear powderless gloves if possible, since the powder may interfere with the laboratory examination. Moisten the speculum with warm water, not with lubricating jelly, as the jelly may interfere with forensic tests.
Savita,
Before the examining physician comes, let a trained nurse calm and reassure the young victim. Building rapport with the victim is crucial. Otherwise, the victim will be hesitant to talk, making her own case weak. Let her explain to the victim gently what the medical examination is all about and its importance for the trial. Remove her fears about the process she is going to go through. This is a very important and critical step. Let the paramedic staff give the victim undivided attention for a few minutes. The step 1 is to get the legal consent form signed. The doctor must take the legal consent before she begins the evaluation.
तुम्हें देखेंगे सुरजीत तुमने समझाया इसको
Please explain to the victim what the consent is for, why the girl must sign it, and how it is going to help her get justice. Consent must be taken in the victim's native language.
Legal consent is a must in every type of medical legal case, be it a police referral, be it a direct request of the victim or her guardian for a medical examination, be it a rape case or a case of sexual trafficking for commercial sexual abuse.
It's important that the physicians and the paramedic staff's attitude be non-judgmental. It is a commonly held prejudice in our culture that the girls who get raped are the loose and bad sorts of girls who invite it. Inquire within and make sure that this is not the attitude you or your staff holds. Such an attitude, if harbored and communicated, will create negative feelings and the victim will become uncooperative. Make sure that the examination meant to help the abused child doesn't itself become a source of distress for her. Second, as a physician, it is not your responsibility to determine whether a rape took place or not. Your responsibility is only to carefully examine the victim, collect the evidence, and document the findings. Never comment whether a rape has taken place or not. Rape is a legal term, and only a court of law can comment upon it.
बेटा मैं तुमसे कुछ सवाल पूछूंगी पहले ये बताओ ये हादसा कब हुआ
Now the next step is to start filling the examining physician's report. The first page is a detailed history form. It is not all inclusive but covers most of the questions which need to be asked about the victim. Be aware that some victims may not understand medical terms. It is sometimes necessary to describe body parts or specific sexual behavior.
तो ये हादसा तुम्हारे साथ कल रात 10 बजे हुआ अब मुझे जरा सोच के बताओ कि उसने तुम्हारे साथ संभोग किया मतलब अपना अंग तुम्हारे अंदर डाला
Occasionally, it may be necessary to use more explicit or even slang terms to ensure the victim clearly understands the question.
उसने स्खलन भी किया समझते हो इसका मतलब पानी अंदर छोड़ना उसने पानी छोड़ा
Ejaculation may occur within the vagina during the assault. However, semen may be deposited on the victim's skin or clothing. Proper examination of all the three is necessary to not miss the evidence.
ठीक है क्या तुमने उसके बाद कपड़े बदले नहीं बदले उसके बाद तुम नहाई हो नहीं नहाई
A common misconception is that douching or bathing eliminates the ability to collect evidence. Actually, seminal fluid will often be recovered from the vaginal and cervical mucus, even if douching or bathing has occurred.
ठीक है अब तुम ये कपड़े उतारोगी क्योंकि ये कपड़े आगे जांच के लिए जाएंगे सुरजीत तुम इनके कपड़े उतारने में मदद करोगी और ये सारे कपड़े हैं संभाल के रखोगी और इसको एक गाउन दो पहनने के लिए ले जाओ तुम इन्हें
The victim's clothes must be carefully collected and placed in the evidence bag labeled Step 3, Outer Clothing. The underclothing is kept separate from the outer clothing to prevent contamination. Prior to the exam, prepare the slides that will be required to be used in Step 9. This will save time when the speculum is in the vagina. Finally, prior to beginning the examination, the appropriate size speculum should be chosen. Most of the times, a medium-sized Cusco speculum will be appropriate because of its narrow and flat blades. Now we resume the physical examination, that is, step 4. Usually we don't find multiple types of debris or stains. However, if more than one type of evidence is found, you must use a separate packet for each. Debris found in the pores of the skin is often an important link to the crime scene and the assailant. The entire body surface should be examined from head to toe for fibers, leaf matters, and so on. Remember, it is imperative to place debris from each different site in a separate packet and mark accordingly. All the envelopes in the kit are self-sealing. Never moisten them with saliva. If a struggle took place, the outer layer of the skin of the assailant may be trapped under the victim's fingernails. It may be used for DNA analysis. Debris should be placed in white folded paper and then placed in packets marked step 4. A collection stick is enclosed within the packet. Use it to perform the fingernail scraping. The scraping should be done very gently as to remove loose debris only and not the victim's nail bed tissue, which is rich in the victim's DNA. Do this over the paper. Drop the collection stick in also. Refold the paper. Place items in the envelope and mark accordingly. Any suspicious stains should be lifted by placing a drop of distilled water on the stain and rolling the collection swab across the stain. The swab is then placed in the tube. Remember, each item of evidence collected in step 4 must go into a separate envelope. Accordingly, the kit has more than one packet. If the system provides for it, ask for a photographer and take the photographs recording the injuries. If any are found, describe the injury or injuries on the physician's examination form.
सविता, एक सवाल का जवाब दो मेरा। उस आदमी ने तुम्हारी छाती को मुंह लगाया था। मैं तुम्हारी एक छाती से जांच लूंगी, कोई परेशानी की बात नहीं है।
If the assailant's mouth contacted the victim's breast, place a drop of distilled water on the nipple area and swab with the collection swab. If the assailant is a secretor, which means he secretes evidence of his blood type into the saliva, semen, and other body fluids, it is possible to determine his blood type and possibly DNA fingerprinting by collecting dried saliva from the breast. Remember, the envelopes are self-sealing and should not be moistened or licked by the physician. It is now time to begin pelvic examination. Please remember, if the victim is a minor and resists examination, or if she is bleeding profusely, the medical examination must be conducted under anesthesia. This instruction is not to be ignored under any circumstances.
ये कंघी देखती हूँ। इस कंघी से मैं
The
सबसे पहले
first
तुम्हारे
step
बालों में
is
से
to
जांच
comb through the pubic hair with a plastic comb. Place the collection paper under the victim's butts and gently comb through the victim's pubic hair. Loose or foreign hair will drop onto the paper. The comb is then placed on the paper. The paper is folded and put in the envelope.
अब मैं तुम्हारे बाल थोड़े से
Clip
काट
several
के
hair close to
आगे
the skin
जांच के लिए भेजूंगी।
and place the
बिल्कुल
sample
परेशान ना
on the
हो।
collection paper.
चिंता की कोई बात नहीं है, जस्ट रिलैक्स।
Pubic hair, which appears to be matted or stuck together, may contain seminal fluid. This area should be clipped close to the skin and submitted in the packet for matted pubic hair. Now, carefully examine the vulva for signs of trauma. Red discoloration representing bruising, tears of the posterior fossa, and bleeding from the hymen are examples of the kind of findings you may come across. The kit contains slides that can be closed shut. One is marked C for cervical and the other V for vaginal. Cotton swab appears to be the most effective vehicle because they provide the highest DNA material for analysis by common methods. The swabs are contained in their respective tubes labeled C for cervical and V for vaginal. The vagina is carefully inspected, and using the vaginal swab, a sample of the fluid from the posterior fornix is collected. The swab is then used to make a wet smear. Prepare the wet craft by rolling the swab across the slide. Seal the swab by placing it in the tube or box labeled vaginal swab. Retrieve the swab from the tube labeled cervix and collect fluid and mucus from the cervix. This swab too is used to make preparation as with the vaginal fluid. Since the cervical mucus may be thick and difficult to get onto the slide, the cover slip is sometimes used to ease the mucus onto the slide. The swab is then placed in the tube labeled cervix. Washing of the vagina is then performed using the preloaded syringe and catheter. The fluid should be injected into the upper vagina and then agitated slightly with the speculum. Draw the fluid back into the syringe and then place it in the red top tube provided. This will also be examined in the forensic laboratory for the presence of spermatozoa, protein markers, and DNA. The anus tool used for the examination consists of two parts, a hollow sheet to allow visualization and an obturator to allow safe and easy insertion. It helps to perform the anoscopic examination using lubricating jelly, which is water soluble. The obturator and sheet should be slowly inserted into the anus and used for carefully visualizing a close-up for tears and contusions. Replace the obturator prior to rotating the anoscope. Inspect all four quadrants and, after careful examination, collect the fluid samples with the swab and prepare mount slide. Perform the culture If the victim was forced to perform oral intercourse, inspect the oral cavity and collect the appropriate swabs and cultures. The areas most likely to yield spermatozoa are the vocal gingival pockets just above the second molar or the interdental spaces. Take care not to induce bleeding during collection. Step 14 constitutes of collection and analysis of the victim's blood. Analysis will be performed at the hospital's laboratory. This is done to ascertain the victim's blood type. It is also done as a service to the victim because the blood is screened for HIV, hepatitis B, and also for syphilis, an additional red top blood tube, and a urine specimen should be collected if toxicology studies are required. This should be done if there is suspicion of drug or alcohol intoxication. The examination of the victim is now completed. The evidence kit is sealed with a tamper prevention tape contained in the kit and is placed in the bag labeled biohazard. Place the bag in a locked refrigerator or under lock and key in a secure area till the time it is delivered to the police authorities. Once you have examined the patient, therapeutic aspect is important for prevention of pregnancy and STDs, including HIV and hepatitis B.
सविता, मैं तुम्हें एक बात और बताना चाहूँगी। ऐसे हादसे के कारण दो तरह की परेशानी हो सकती है। एक तो प्रेगनेंसी हो सकती है, एक संक्रमित रोग हो सकते हैं। हम इन दोनों के लिए तुम्हें दवा दे सकते हैं। क्या तुम ऐसी दवा लेना चाहोगी?
Yes, ma'am.
ले लोगी दवा? ठीक है।
Data concerning the incidence of STDs following a sexual assault are few. However, it is estimated that gonorrhea is contracted in 1 in 30 cases, chlamydia in 1 in 10, condyloma in 1 in 4, HIV in 1 in 1,000, and syphilis 1 per 1,000. The incidence for transmission of hepatitis B is largely unknown. However, in non-immune or unvaccinated individuals, immune globulins should be considered. Suggested protocol and dosages against these potential infections are shown here. In non-pregnant, non-allergic individuals, one of the most common and accepted regimens for prophylaxis against both gonorrhea and chlamydia is doxycycline, 300 milligrams orally stat, followed by 100 milligrams twice daily for 3 days. Floxacin is also an acceptable alternative at a dose of 400 milligrams twice daily. A little tolerated but more expensive alternative is azithromycin in a one-time dose of 2 grams orally. In pregnant and adolescent, erythromycin is an alternative at a dose of 1.5 grams orally stat, followed by 500 milligrams 4 times daily for 7 days. The risk of HIV infection is small. However, should prophylaxis be indicated, the correct regimen usually consists of triple drug therapy with zidovudine, lamivudine and nevirapine, or stavudine, lamivudine and nevirapine. This is now available in the country. The incidence of pregnancy in susceptible victims is estimated as nearly 8 for 100. Prophylaxis against pregnancy may be effective up to 72 hours. Using dedicated levonorgestrel emergency contraceptive pill, the pregnancy rate is brought down to 1 per 100. By using conventional oral contraceptive pills, it is brought down to 2 per 100. In order to enhance evidence collection, it may be necessary to employ one or more special forensic techniques: colposcopy to search for microlacerations, toluidine blue staining to enhance the texture of microtrauma, Wood's lamp examination to enhance the texture of stain or the skin, especially seminal fluid stains, forensic odontology for bite mark casting. Colposcopy is the examination of the lower genital tract using a binocular microscope. By bringing the skin of the vulva under magnification, it is possible to find microlacerations, which will otherwise be undetected. If the victim reports that she has had no sexual activity for several days prior to the assault, and especially if the victim is virginal, microlacerations are a significant finding. Toluidine blue is a stain which assists in identifying small lacerations. The stain is applied with a cotton tip applicator or sprayed on the vulva. The excess is washed away with water. The stain is taken up by the subcutaneous connective tissue exposed if lacerations occur. Thus, these lacerations show up as short lines with staining. A Woods lamp is a very useful tool in detecting stains, especially semen, which is not easily visible to the naked eye. To use it, darken the room and project the UV colored light across the skin while looking for areas which shine or fluoresce. The Woods lamp illuminates the surface beneath the skin. The areas which show white or proluminescence are then sampled with moistened swab for later examination in the laboratory. Additional special techniques include forensic odontology, in which bite marks are photographed and 3D casts are made, which may be matched to the jaw pattern of the assailant. The findings of these special forensic examinations should be recorded on the physician's examination report. Now we move on to the age determination.
Age verification of trafficking and sexual abuse victims is mandatory under Section 15, subsection 15A of the Immoral Trafficking Prevention Act of 1956. Age verification establishes whether the victim is a major or a minor, and this has a critical bearing on the outcome of the case. According to the ITPA, trafficking of minors is a more heinous offense and it warrants much more stringent punishment. Age determination constitutes of 4 parts: general physical examination, examination of secondary sexual characteristics, dentition and radiological examination. Conduct a general physical examination and secondary sexual characters examination using the age related data for height and weight for boys and girls separately, and examine the development of secondary sexual characteristics like hormonal changes, axillary hair, acne, menstruation, breast development, the pubic hair in line with Tanner's indicators of puberty. Dental X-rays like orthopentogram or an OPG will establish the age fairly accurately between the ages of 6 and 12 years. Similarly, radiological examination of bones will give a fairly accurate age estimate by studying the ossification centers of long bones. A thorough dental and radiological examination can give correct age estimation within plus minus 6 months. The age determination test should be conducted for all trafficked victims referred to a medical officer for a medical report, whether or not the investigative agency has specifically requested for it or not. Never rely on a single method for age determination. A combination of methods just discussed should be used. The medical legal report should be submitted to the investigative officer within 48 to 72 hours of conducting the examination.
Standard protocol for medico-legal examination of survivors has been revised by Lok Nayak Jayaprakash Narayan Institute of Criminology and Forensic Sciences, Ministry of Home Affairs, Government of India in 2019. I am happy to share that I was part of this process. These are based on guidelines issued by Ministry of Health and Family Welfare, Government of India in 2014 regarding the same. The aim of revision of standard protocol is to collect quality evidence material step by step without missing anything during medico-legal examination of survivors of sexual assault. The sexual assault evidence collection kit has a booklet incorporated in it for reporting and documentation in the prescribed format in triplicate, which are color-coded and self-inking copies. The first copy is to be handed over to the police investigating officer. The second copy is given to the survivor, and third is kept for the hospital records. The booklet has standardized format for taking consents for medical examination, for treatment, medico-legal examination, and sample collection for clinical and forensic examination. The format has prescribed medical interview for history, examination, and sample collection in the new kit. The kit has options to document medical opinion also in the prescribed formats. The standard SAFE toolkit has numbered, titled envelopes in it, which are there for stepwise evidence collection by healthcare professionals. It has also incorporated all important logistics, including DNA card, etc. History-based sample collection is done sequentially. Envelopes are sealed after putting the sample inside. The envelopes which are not used are marked "No sample collected." All samples containing envelopes are then put in the box and the box is sealed, signed and stamped by the medical officer. The chain of custody is also mentioned on the cover and signed by all involved.
We now provide you with a brief summary of all the steps involved in conducting a thorough medical examination. Step 1. Obtain victim's consent. Step 2. Obtain the victim's history and record all the information on the physician's examination sheets. Step 3. Obtain the victim's underclothing and place them in the appropriate bag and label. Step 4. Perform complete body surface examination and collect any foreign material. Perform fingernail scrapings if indicated. Request photographs if indicated. Sketch findings on the examination sheet. Step 5. Collect secreted test swab from victim's breast if oral contact occurred. Step 6, 7, 8. Collect, comb, clip matted hair samples with the enclosed scissors. Step 9. And collect slides and swabs. Step 10. Collect cultures. Step 11. Collect washings of the vagina. Step 12, 13. Perform oral and anal examinations as indicated by the victim's history and collect wet slides, swabs and cultures. Step 14. Collect samples of the victim's blood for forensic and clinical testing. Perform additional forensic techniques as indicated, such as colposcopy, toluidine blue staining, Wood's lamp examination, bite mark impressions. Pack, label and sign the evidence envelopes and place them in the kit. Seal the kit with tamper prevention tape to be forwarded to the forensic lab. Dispense prophylactic medications if indicated and desired.
My colleagues, Dr. Sangeeta Gupta, Vice President of Delhi Gynecologist Forum and Vice Chairman of North India Gynecologist Forum, Dr. Anita Rajoria, the Chairperson of Public Awareness Committee of North India Gynecologist Forum, Professor Gaurav Agarwal, the medical legal consultant and a lawyer, have just presented to you the standardized methodology of medical examination, forensic evidence collection, and age determination of sexually abused survivor. Let's recapitulate. The premise we started with: first, that the conviction rate must be raised to prevent sexual crime. Second, for increasing the conviction rate, high standard of proof is required by the criminal justice system. Prevention of sexual crimes is very, very high on national agenda. Rape crisis centers are in the process of being set up across the country. As the government sets up these dedicated centers for the survivors of sexual abuse, more and more doctors must empower themselves with expertise in medical and forensic examination. We, the medical fraternity, must ensure that no perpetrator of sexual crime should go scot-free just because of lack of training of doctors and because of the badly conducted medical examination. North India Gynecologist Forum, Delhi Gynecologist Forum and Indian Medical Association hope that you all appreciate this film
aimed at imparting quality content to the medical fraternity across India. Thank you.
I'll invite comment from Dr. Gaurav Agarwal, then by Dr. Sadhana Gupta, then by Dr. Ragini, Madam Kiran Agarwal, and Dr. Swati Bhave. So over to you, Dr. Gaurav Agarwal.
Thank you, ma'am. Thank you for the opportunity. So at the outset, I'll just make two little points over here. The first is that, in the recent past, about 2.5 years ago, within the past 2.5 years, I got 3 cases against doctors where a FIR was registered. And in all the 3 cases, the common issue was that a school-going child was abused by someone that the child knew in the family, or like, the transport bus and all. And when they came to me, the one simple defense is that, डॉक्टर साहब ये सब भी करना होता है, हमें तो पता ही नहीं था. So here lies the importance of such medical examination in this film, that this needs to be brought to every. And another issue Dr. Sharda ma'am raised, we started almost 17 years ago that every person should be trained and this should become a part of MBBS curriculum. So it is good that I'm happy to share it is now a part and parcel of MBBS curriculum, but not in so much details that this film outlines. And the good thing is that when these students, MBBS graduates, come up next 5 years, 10 years, 15 years, and they have the job and they're doing this medical examination for sexual abuse victims, they will be, they are already empowered and they will be aware about how to go about this examination. But the bad part is that what about lakhs of doctors who are working in the periphery in each and every district hospital who conduct these examinations, in all the medical colleges who conduct these examinations, in emergency department of corporate hospitals, nursing homes. These 3, doctors were working in, one of them was in corporate hospital and 2 others were in nursing homes in the private sector. So they did not know how to collect the evidence and what all details have to be carried out during the entire examination process. So I think this is the right opportunity that, national leader is a forensic guy, Dr. Sharad Agarwal, and I think the trio of IMA headquarters led by Dr. Sharad, the Delhi Gynae Forum, and the respective Ministry of Delhi, or maybe some other states who coordinate at the national level, the Minister of Health and Family Welfare, Government of India. This trio can come up and urge that this film be screened in every medical college throughout the country, and every doctor who is performed in medical examinations of such victims in every district of this country, almost 660 districts or something, should be trained in examination of such victims. So this was from my end, Dr. Shah.
Thank you so much, Dr. Gaurav. Dr. Sadhana, we want waiting for your small crisp comment. Dr. Sadhana Gupta.
Thank you, madam. And there cannot be better day than for release of this video film on the World International Women's Day, because any sexual assault is actually soul breaking and it casts shadow all over the life. So very, very important thing is that no woman, whether it is professional, educated, rural or urban, is immune to sexual violence. And this is time when the women are coming forward. They are not that hesitant. Women and families are coming forward for the complaints, and it is our way that we should be confident. We ourselves should not be hesitant and like referring to the government and like losing times and opportunities. A wonderful film it is, and the video displays will clear actually how to do it. It is not difficult. It is just to be a methodical approach and the knowledge that we have. And as a part of North India Gynae Forum, DGF and IMA, we are going to circulate it to popularize in medical college, teaching faculties, societies of the all gynecological societies, because it is our way that we have to be confident, and it is also a reminder to our consciousness as well that we owe this much to these women, and we because why they are not coming, because the always assaulter says that they will get loose, they will be relieved, they will not be punished. And when there is a public awareness that we are confident, every government as well as private doctor can do it, can help in making it, I think that is going to be a big way. Hearty congratulations, great effort by madam, and we see your continued commitment when you, Dr. Sangeeta Gaurav, are looking so young, and that speaks volume of your continued commitment and never losing the vision and the cause what our country needs. Thank you very much, madam.
Thank you very much. Is Dr. Ragini there? Dr. Ragini Agarwal?
Yes. To all of you, it's a very, very inspiring, heart-touching, and very educative film. Thank you, madam, for bringing it forward. And Dr. Sangeeta, you have shown it very, very beautifully. My take on what Dr. Gaurav has said, that what about the doctors who is already in the field and don't know that it is their responsibility, they are not trained to do. My heartily wish for that is, IMA is our parent organization and it has a women doctor wing. I think that women doctor wing has made for these type of purpose, to percolate something which is very important, very personal for the woman. Every single doctor who is working either in a private field or in a periphery or in a corporate hospital or in a nursing home, most of them, or I can say all of them, are the IMA member. And by being a woman, they are forced to be the part of the women wing of IMA. So I think women wing of IMA, instead of doing dancing and singing, they will take it as a challenge from the center to do something for the upliftment of the women, not the upliftment of the women doctors in the society. And every single person, if not ready to pass this examination, they should be barred to be the IMA member. Only then every doctor will learn how to do it, and they will aware, yes, it is our duty to do something good for the society and for the women. And as madam was the head of the women doctor wing of the IMA, I appeal you that this type of is a mandatory to be the IMA membership. Any woman doctor or other doctor also, if they are, because many a time other doctor who are the forensic doctor or head doctor, they should also aware that it is a responsibility. They should pass exam and only then they are allowed to the IMA member. Thank you so much. That's really, really an eye opener.
Thank you, Dr. Ragini. I think each and every point has been incorporated in this film and not left, for the people to search on the internet and, get all those books. Now I'll invite Dr. Kiran Agarwal to make a brief comments about. Dr. Kiran Agarwal had been a past Delhi president of Indian Academy of Pediatricians, and involved in a lot of POCSO cases. So over to you, Dr. Kiran Agarwal.
On 11th of February, there was a 10 years of POCSO Act review strategic meeting was held with the Special Commissioner of Police for Women and Children. This was organized by the NGO Prayas, who was responsible for this national study on child abuse carried out in 13 states. And this, as a recommendation of that study, this POCSO Act, it came out. And this thing was that POCSO cases are increasing. there was an issue of this consensual sex, which was increased from age of consent for sex from 16 to 18. There are teenage pregnancies. So these issues were discussed in that meeting. The special, I was able to, I was supposed to actually, as a panelist, I was supposed to speak on how the adolescent sexuality develops and how these consensual sex problems are dealt in other countries. And I've loudly raised this issue of sex education of children in schools is not allowed in the school. That was accepted by the police commissioner. This was a good news. And why I came to Dr. Sharda madam, and I'm so thankful to her for taking up this so briskly. I'm doing child protection officers training and CWC members training across India on the platform of Ministry of Women and Child Development. And there are so many issues came, and I was using this your film, which was made in 2006 that time. And I was using this kit also during my trainings, and they were so fascinated by just looking at that kit that nobody ever told us about this thing, and we never came across this thing. And there were so many issues came up, like madam, police जो consent का issue है, पुलिस वाले victim refuse कर देते हैं उसके लिए, and पुलिस वाले वो कहते हैं कि क्यों refuse किया. हम उनको समझाने की कोशिश करते हैं कि जरूरी है कंसेंट देना, एग्जामिनेशन एंड इसके कलेक्शन ऑफ द मटेरियल, क्योंकि तो विक्टिम का कहना होता है, कई विक्टिम्स का कहना होता है कि पुलिस वाले हमें बोलते हैं कि ये इतना पेनफुल प्रोसीजर है, इसकी तुम कंसेंट मत देना, अगर तुम कंसेंट नहीं दोगी तो डॉक्टर्स तुम्हें फोर्स नहीं कर सकते. This was a very, very serious matter. They wanted, the CWC chairpersons, they wanted to know how these victims are examined in the hospitals, how doctors are sympathetic about all the procedures to them, how they, if it is considered they are hungry, they are thirsty, or it is imposed on them कि जल्दी जल्दी से करा लो, as we all know what happens in the hospitals. कि हमें जल्दी है, हम फ्री नहीं है, जल्दी से कराओ, नहीं तो I mean this is all the all.
We have to take comments from other people also, please. We will
Is
tell
it
you many forums.
So these things for that I thought there is some modification is needed in this film, and I came to Dr. Sharda madam.
Thank you.
तो आपके कहने में समरसॉल्ट हो गया इस फिल्म का. So thank you very much.
नहीं, अभी बच्चे इसमें in case of children, how to examine the children, कुछ issues हैं उसमें, हम लोग बात करेंगे उसमें.
Another film by you, Dr. Swati.
Okay.
Swati, if you're there, Dr. Bhave. Hello.
Hi, yes, I'm there, Sharda.
Please.
Thank you, ma'am. It was a pleasure meeting all of you virtually, and it takes me, I'm located in Pune now, takes me back to Delhi days. Sharda ji, you invited us for that women's committee meeting in IMA. I still remember that, and I remember the workshop you conducted along with UNICEF. It was an excellent workshop on child sexual abuse, and I learned a lot from that. And the second person who has inspired me for work for child sexual abuse is Kiran Agarwal. When I was president in 2000, she took me to Prayas and she exposed me to this. And in the 2006 textbook, the first adolescent textbook in India, which was called Bhave's textbook by all my colleagues, Kiran and I wrote a chapter on child sexual abuse. And Dr. Gaurav Agarwal wrote a chapter on age determination. So we have been trying to sensitize our pediatricians and adolescent specialists since 2006 to get involved into child sexual abuse and be sensitive and do the examination. And as Kiran and you rightly said, we need a separate film for examination of children, because this film was excellent for examination of an adolescent girl or an adult woman, but we need to have forensic examination of young children also. And I think that should be the next step. And thank you so much. Kiran, thank you for sending me the link. It was a pleasure seeing the film. And whatever we can do, ma'am, to propagate this film in the community, doctors, in addition to the medical colleges, which you all are doing, please reach out to me. I'll be able to help you in whatever way you.
given my phone number. Please send me the emails there, so I will see to it that the film reaches each one of you. Now I will request Dr. Raj Bukaria to make comment. Dr. Raj Bukaria. Raj is not there. Leena, if you're there.
Ma'am, this was an excellent film. I think it should be in the WhatsApp or whatever in the phone of every doctor, because most of the doctors, they don't know how to examine the rape victim. It's an eye-opening, and every step is mentioned so clearly that you can't miss any step. And this will really increase the conviction rate and help in the examination and giving. But one thing I like to say, ma'am, the post assault care of the victim is equally important. It's not that we just finish our work on that.
See,
So
we have written everything about it. Everything can't be covered in the film.
Yeah, ma'am. So
they require a reference.
Part 2 should be there.
Yes. Dr. Raj, now you are the head of, as far as the Kanun Ki Pathshala is concerned, and now it is your duty, and Dr. Sangeeta is going to give you full help for the same.
Me with Dr. Sangeeta guidance and your guidance, we will definitely, it will carry it forward.
Dr. Leena, another co-convener of the medical legal cell. Dr. Leena, your comments.
Yes, ma'am, it was a wonderful film. I mean, it sort of clarified everything that we wanted to know for examination. I just want to say that to all my colleagues who think that in a private hospital, such kind of a case is not going to come to you, just forget that. Patients are coming. We had such a case which came 2 months back, and we had to do the procedure, and we did it meticulously. But what I'm just trying to say is the moment such a patient comes, everybody is, which is something not done on a routine basis. So we really need to sensitize each and every one of us, whether we are in a private organization, whether we are in a big corporate hospital, or we are in a government college. So there is absolutely no escape. We all need to know this meticulously. It should be, I think, the most important thing with the rising number of cases that are coming. And we should be prepared to examine a patient like this.
Dr. Shakuntala.
Good evening, everyone. And it was initially, the movie was absolutely heart-wrenching. The kind of scenes that we saw of rape and sexual victims, it was really heart-wrenching. But it is very heartening to see the stepwise examination and clarity on the examination. We in private practice come across these sexual victims only when they report to us for MTP. And all we do is inform the police, and the kind of lack of empathy and dignity and respect that is shown by the police and by the attendants is something which has made me think that we as private practitioners, number one, we should be provided these safe kits, these standard kits for examination. That is very, very important. We are ready to buy them. Number two, we have to we have to train our casualty officers as to what should be the steps of, calling the gynecologist and sensitizing. These are very, very important things for private practitioners and for the nursing home owners as well as for us gynecologists. I think this film will go a long way in creating such awareness and percolating the knowledge to all the gynecologists, whether they are in government hospitals or in private practice. And as Kanun Ki Pathshala co-chair, I think we will carry it forward and we will make it very, very pertinent that all our attendees, they understand, and under the able leadership of Dr. Sharda Jain Madam and with my colleagues, I think we will carry it forward. Thank you very much.
सबको गाइडलाइंस की एक लाइन पता होनी चाहिए, सबकी वर्कशॉप होनी चाहिए. कहना मैं फिल्म भेज दूंगी, पर फिल्म देखने से काम नहीं होगा जब तक कि फिजिकली आप इसको सीखेंगे नहीं, कैसे इसको एग्जामिन करना पड़ेगा. थर्ड चीज ये है कि the onus, this has to be another, see, from 2006 to 2023, hardly 5% people know about this particular film. But I think, it has to go in detail, and I'm sure Kiran Agarwal and Dr. Swati will definitely come out with a film on the POCSO, because as far as the POCSO is concerned, again, this is a nightmare for all of us. हम लोग उसकी एज जो है वो 9 साल की है, हम पता नहीं बढ़ा चढ़ा के उसकी एज बढ़ा देते हैं और वो लीगल से निकल जाते हैं, वो गलत है. Whatever we are doing is we are harming our community. But I think, thank you very much, and my salute to Dr. Sangeeta and my colleague. Sangeeta's effort has been more than 50.
Done a great job.
Great job. In the last, I will rope in Dr. Anita Rajoria to say a vote of thanks. Dr. Anita Rajoria replaced my earlier dear friend, Dr. Sunita Fotidar. Over to you, Dr. Anita Rajoria, for thanks.
Thank you. Thank you, ma'am. First of all, thanks to each and every single woman who has existed in the present, past, and future. You are needed, you are necessary, and you are loved. You have a purpose. More people look up to you than you will ever know. Thank you for being you. Thanks to Dr. Sharda Jain, ma'am, for motivating all of us and showing the path to make and review or modify this film, which will help medical personnel to, learn how to learn the art and science of collection of evidence of sexual assault survivors. Thanks to Dr. Sangeeta Gupta ma'am and Dr. Gaurav sir to make me a part of this film. Dr. Sharad Agarwal, who has kindly consented to be the chief guest for this event. Thank you to sir, and thanks to Vandana Bagga ma'am for gracing the occasion. And I'm really indebted to all the valuable comments by my dear friends, Dr. Kiran Agarwal ma'am, Dr. Swati Bhave ma'am, Dr. Gaurav Agarwal, Dr. Sarda Gupta ma'am, Ragini Agarwal ma'am, Dr. Manju Puri has also joined us, Dr. Raj Bukaria ma'am, Dr. Neena Shmuda, Dr. Shakuntala. Thank you so much. And happiness and joy are the most beautiful colors in life, which I wish should stay forever with you. Happy Holi and a very happy Women's Day, everyone. Incredible women you all are. Shine, keep on shining, not just today, but every day. Continue to rock the world. Thank you, everyone, and thank you, dear Malti, for giving us this platform. And thank you, my dear delegates who have joined. We were more than 100 at a time. Thank you, everyone, for joining.